Time now for Morning Rounds, our look at the medical news of the week. First up, the benefits of a better diet. Most of us are aware there's a relationship between our food choices and our overall health. But what's the real impact over time? Newly published research from the New England Journal of Medicine examined data from 2 large studies.
They looked at the relationship between the quality of one's diet and risk of death by using 3 different dietary scoring methods. They found a 20 percentile increase in diet scores was associated with an 8 to 17% reduction in deaths. Here now with more on this study is CBS News chief medical correspondent Dr. Jon LaPook and CBS News contributor Dr. Tara Narula. Tara, take us through some of the results from this study.
So this was a very large study. They looked at about 70,000 participants, and they assessed their diet quality with the scores, as you mentioned, over a 12-year period. And then they looked for a 12-year subsequent period to see what the death rates were. And they found a couple things. They found that those people who had the poorest scores at baseline and improved the most had a 15 to 28% decrease in their mortality. Those people who had consistently high levels of diet scores decreased their mortality 9 to 14%. And on the other hand, those people who had declining diet quality increased their mortality by about 6 to 12%. So what is the real takeaway from this? It's a couple things. One is that this is really about healthy dietary patterns, not about one single nutrient. They looked at things like the Mediterranean diet and the DASH diet. The second is that small changes can have a big impact. So the authors of the paper discussed this idea that even swapping out or substituting out red meat or processed meat 1 serving a day and switching it with legumes and nuts, you can improve your diet quality by about 20%. And the last is that it's never too late because the majority of participants were over 60 years old.
Oh, that's very interesting. John, is there a difference between, say, if you just do this for a couple of years and if you do it over a longer period of time?
Yeah, as you would expect, the answer is yes. So if you kept it up for 8 years, mortality went down 11%. You kept it up for 16 years, it went down 26%.
Wow.
And if you think, well, what do we need a study to show us that? I cannot tell you how many patients over the years, when I say, you need to adjust your diet, they'll say, well, wait, it's going to turn out that, like in Sleeper, in that Woody Allen movie, that in the future it's going to turn out that deep fat's good for you. And it's, you may think it's obvious, but it's great to have the data.
Tara, what are some of the characteristics of the people that improved their diets over time?
So those that improved seemed to be younger, they were more physically active, they consumed less alcohol. When you looked at what they were eating, no big surprise. They increased the number of whole grains, or the amount of whole grains in their diet, increased the vegetables, the fruits, the omega-3s or the fish that they consumed, and they decreased things like sodium, processed meat or red meat, and sugary beverages.
It feels like we hear the same things and are just constantly reminded we need to do it. Our next topic actually deals with cancer and the social impact it can have on adolescents and young adults. The study was published in the journal Cancer. It
examined the social functioning of this age group within 2 years of their cancer diagnosis. There were 215 participants at the start, with 141 completing the follow-up survey 24 months later. All were between the ages of 14 and 39. John, this is something we haven't seen a lot of studies on, the social effects of cancer. What was one of the big findings here?
Well, as you might expect, they tend to bottom out in terms of their social functioning at the time of diagnosis. In the next year, they climb up, but then they kind of level off for the next year. And I knew nothing about this until about 5 or 6 years ago. I met a guy named Matthew Zachary, who at 21 was diagnosed with brain cancer, started a group called Stupid Cancer as a support group. And I learned that in this group, it's not pediatrics, it's not older, they have very special problems. So sexuality, you're going on your first date. What do you say? When do you say it? You want fertility. You go into the job interview. Who do you say to when? They need support groups, and it's really great that now this is getting the attention it deserves.
I feel like you touched on some of them there, but did they sort of figure out some of the reasons for the social issues?
So interestingly, they found that nearly 32% had persistently low level of social functioning throughout the period that they were studied. And when they looked at issues involved, a lot of it was people who were off treatment. And so I think the big issue here is that even though you may have been cured of your cancer, there are survivorship issues, things where you're worried about negative impacts on financial situations, on your relationship, on whether you're going to be able to have kids, your body image, on what your work plans are going to be. So I think one of the big takeaways is that we need to have support not just for people during the time of their treatment, but in terms of reintegrating them back into their life when they have become a survivor.
Were there other recommended strategies for this, John, in terms of dealing with this?
Yeah, one of them is, support group. Well, it should be in your age group.
Yeah.
You don't want to have somebody who's 18 go into a sport group where there's somebody who's 90 there.
It's a completely different set of issues.
Different set of issues, and things that you would expect intuitively obvious, like in the hospital, have places that are pleasant. You know, have for the kids, have games, things that are like, you know, things that they like to do, not things that somebody, again, who is 60. And then again, understanding, as Tara was saying, that there are special issues. So you may survive the cancer and then later on have even secondary medical issues. In the past, they didn't survive to get the secondary medical issues, problems with their heart and other problems. So it's great that this is getting focus on it now, and we need to really specifically address these issues.
All right, finally, a new take on wearable technology, one that can translate motion into words. New research in a journal published by the Public Library of Science looked at a new glove that can decode the American Sign Language alphabet. It then transmits the words to electronic devices. The glove was created by researchers at the University of California, San Diego. It cost less than $100 to make, and the study authors believe the technology will have multiple applications in the future. One word, wow.
Amazing.
Yeah. And that is just wonderful. And thank you to Caitlin Luna from Gallaudet University, who taught me how to say wonderful.
Amazing the difference that just a bit of technology can make in lives for everyone.
At that price,
$100. Exactly.
Yes.
That's extraordinary.
Opens up the world and connects us all. Doctors Jon LaPook and Narula, thank you very much.